Yes, my name is Dr.Sumaira Abbasi, and we'll be studying about orbital cavity and its contents. Now, basically, what are the orbits? The orbits are bilateral structures in the upper half of the face, below the anterior cranial fossa and anterior to the middle cranial fossa. It contains eyeball, fascia, extraocular muscles, then vessels, lymphatics, nerves, includes optic, oculomotor, cochlear, and fusing branches of trigeminal, maxillary, and ophthalmic, along with sympathetic nerves. Lacrimal glands in their orbital part. Basically, the bony orbit consists of 7 bones. It includes maxilla, zygomatic bone, frontal, ethmoid, lacrimal, sphenoid, and palatine bones. Each orbit is pyramid in shape. It has base. It opens anteriorly onto the face. Then it has apex. It is in posterior medial direction, and it has medial, lateral, superior, and inferior bones. The base is this. It opens anteriorly into the face. Then the apex is directed towards the posterior medial direction. Then it has medial wall, lateral wall, superior and inferior walls. The bones that are that contributes into the formation of orbit are ethmoid bone. There is lacrimal bone. There are palatine bones. Then there is maxilla. Then there is zygomatic bone, sphenoid bone, and frontal bone. Now, this is orbital rim. The orbital rim is formed, it is formed superiorly by the frontal bone, medially by the frontal process of the maxilla, then inferiorly by zygomatic process of the maxilla and the zygomatic bone, and laterally by the zygomatic bone and the frontal process of the zygomatic bone, and the zygomatic process of the frontal bone. The roof of the orbit, the superior wall of the bony orbit is made up of the orbital part of the frontal bone and from the sphenoid bone. It separates the contents of the orbit from the brain in the interior cranial fossa. The other features includes the frontal sinus and the cochlear fovea. The frontal sinus and the cochlear fovea and the lacrimal fossa. The frontal sinus extends into its anterior medially, the cochlear fovea anterior medially for the attachment of fibrous fluid through which the superior oblique muscle passes, and the lacrimal fossa lodges the lacrimal gland. The medial wall consists of 4 bones: the maxilla, lacrimal, ethmoid, and sphenoid. At the junction between the roof and the medial wall are the anterior posterior ethmoidal foramina, which lies on the frontoethmoidal suture. There is a lacrimal groove, which contains the lacrimal sac and is bounded by posterior lacrimal crest and the anterior lacrimal crest. The floor is basically the inferior wall. It is consists of orbital surface of the maxilla and the zygomatic and palatine. The inferior orbital fissure occupies posterior part of the junction between lateral wall and the floor. The lateral wall of the bony orbit consists of zygomatic bone and posteriorly by the greater wing of the sphenoid bone. So this is superior wall, this is medial, this is lateral and inferior. The superior is mainly formed by the frontal bone and posterior wall part from the lesser wing of the sphenoid. The medial is formed by the lesser wing of sphenoid plus ethmoid, lacrimal, and maxilla. The inferior part is formed from the maxillary bone, palatine bone, and zygomatic. The lateral wall is mainly formed by the greater wing of the sphenoid and the zygomatic. Again, the superior or the roof of the orbit is formed by the lesser wing of the sphenoid and orbital plate of the frontal bone. Then the medial wall is formed by the sphenoid bone, orbital plate of ethmoid, lacrimal bone, and nasal bone. Then the floor of the orbit or the floor of the orbit is formed by the orbital surface of the maxillary bone and the zygomatic bone. Then the lateral wall of the orbit is formed by the zygomatic process of the frontal bone and greater wing of this sphenoid bone and the orbital surface of the zygomatic bone. Now, these are some important foramens and fissures which are basically two things. There is supraorbital foramina, which is just above the orbit. Then there is infraorbital foramen, which is just below the orbit. Then there is fissure, which is superior orbital fissure. And there comes here the inferior orbital fissure. And along just beside or just aside side. This along with the superior orbital fissure, there is the optic canal through which the ophthalmic artery and the optic nerve passes. Now there are some fissures in foramen. Number one is optic canal. It opens into the middle cranial fossa. It is bounded medially by the body of the sphenoid and by the lesser wing of the sphenoid. Passing through the optic canal are the two structures. Number one is optic nerve and the ophthalmic artery. Now here is optic canal. This is ophthalmic artery and optic nerve. This is nasolacrimal canal. This is infraorbital groove. And this is inferior orbital fissure through which some structures passes the infraorbital nerve. Now there is superior orbital fissure. It's lateral to the optic canal is a triangular shaped gap between the roof and the lateral wall of the bony orbit. This is superior orbital fissure. It allows the structures to pass between the orbit and the middle cranial fossa. The passing through the superior orbital fissure are superior inferior branches of oculomotor nerve, trochlear nerve, abductor nerve, lacrimal, frontal, and nasociliary branches of ophthalmic nerve in the superior ophthalmic nerve. The inferior orbital fissure, it's again an opening. It separates the lateral wall of the orbit from the floor of the orbit. Its borders are greater wing of sphenoid and the maxilla, palatine, and zygomatic bones. This long fissure allows communication between the orbit and pterygopalatine fossa posteriorly, the orbit and infratemporal fossa in the middle, and the orbit and the temporal fossa posterolaterally. Passing through the inferior orbital fissure are the maxillary nerve and the zygomatic nerve, the intraorbital vessels, and the vein communicating with the pterygoid plexus of veins. Now, this is the optic canal and optic nerve and ophthalmic artery passes through it. Now, this is superior orbital fissure and this is inferior orbital fissure. And this These are the structures which passes from the superior orbital fissure, and these are the structures which passes from the inferior orbital fissure. Now, this is the superior orbital fissure, which is lateral to the optic canal. There is an opening, and there is inferior orbital fissure. These all are the structures which passes from the superior orbital fissure. Okay, this is the optic canal, lateral to it is the superior orbital fissure. This is common tendinous ring, and this is inferior orbital fissure. Now, in the posterior part of the orbit, the periorbital thickens around the optic canal and the center part of the superior orbital fissure. This is the point of origin of the four recti muscles and this common tendinous ring. Now, there is infraorbital foramen. Posteriorly and crossing about 2/3 of the inferior orbital fissure, there is a groove. The infraorbital groove, which continues anteriorly across the floor of the orbit. This groove connects with the infraorbital canal that opens onto the face and the infraorbital foramen. The infraorbital nerve, a branch of maxillary nerve and vessels pass through this structure as they exit onto the face. Now there are some muscles of the orbit. There are two groups of muscles within the orbit: extrinsic muscles of eyeball and intrinsic muscles. The extrinsic muscles of eyeball are extraocular muscles, which involve in the movements of eyeball or raising upper eyelids. The intrinsic muscles within the eyeball, which control the shape of the lens and the size of the pupil. And the extrinsic muscles includes the levator, palpebris, superioris, superior recti, inferior rectus, medial rectus, lateral rectus, superior oblique, and inferior. The intrinsic muscles include the ciliary muscles, sphincter pupillae, and dilator pupillae. So there are some movements of the eyeballs, which includes elevation, depression. Elevation means moving the pupil superiorly, then there is depression, moving the pupil inferiorly. There is abduction, moving the pupil laterally, and there is adduction, moving the pupil medially. There is intorsion or internal rotation, which rotating the upper part of the pupil medially or toward the nose. And there is external rotation or extorsion, which includes the rotating the upper part of the pupil or laterally or towards the temple. There is a superior oblique. This is superior oblique muscle. And this is the inferior oblique muscle. This is superior rectus, this is lateral rectus, and this is medial recti muscle. This one is levator palpebris superioris muscle. These are the origin, insertion, innervation, and function of the muscles of the eyeball. So these are the movements of eye when testing specific muscles. This includes superior recti, direction to move eye when testing muscles as the patient will look laterally and upward. Then inferior recti look laterally and downward. Then lateral rectus is look laterally. Then medial rectus is look medially. To check the medial rectus muscle, the patient will ask the patient to move or to look medially. Then inferior oblique. To test this muscle, will ask the patient to look medially and upward. And superior oblique will ask the patient to look medially and down. Okay, thank you so much.